WHO has been working on the Mpox outbreak in Africa and raising the alarm that this is something that should concern us all. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying.
The World Health Organization has declared Mpox, previously known as monkeypox, a global health emergency due to its rapid spread in Africa. WHO's decision comes after a surge in cases across the continent. Africa has so far reported over 14,000 cases and 524 deaths in 2024, with 96% of the cases from Congo, where a potentially more contagious form of virus has emerged. So what is Mpox? Monkeypox is a zoonotic disease that can be transmitted from animals to humans. Cases are often found near tropical rainforests where infected animals carry the virus. Evidence of monkeypox virus infection has been found in various animals, including squirrels, Gambian pouch rats, dormice, and different species of monkeys and others. The disease can also spread from humans to humans. It can be transmitted through contact with bodily fluids, skin lesions, or internal mucosal surfaces, respiratory droplets, and contaminated objects. Monkeypox was first identified in 1958 during outbreaks in monkeys. In 2022, the virus began spreading through sexual contact, leading to outbreaks in over 70 countries that had not previously reported cases of monkeypox. The virus is related to smallpox but causes milder symptoms such as fever, chills, and body aches. Severe cases can lead to lesions on face, hands, chest, and genitals. So why is the situation in Africa alarming? Mpox has been detected in at least 13 African countries, with a 160% increase in cases and a 19% rise in deaths compared to last year. A new, possibly more transmissible form has been discovered in Congo, with a fatality rate of up to 10%. This form causes milder symptoms and primarily affects the genital area, making it harder to detect and increasing the risk of unnoticed transmission. Burundi, Kenya, Rwanda, and Uganda have also reported cases of Mpox. Ivory Coast and South Africa have reported outbreaks of a different, less dangerous version of Mpox, which spread globally in 2022. So what has been the global response and vaccine efforts? The WHO's emergency declaration aims to mobilize international resources to address the growing crisis in Africa. The 2022 global Mpox outbreak predominantly affected the gays and bisexual men, and it was controlled through vaccines and treatments. Congo has requested 4 million vaccine doses, particularly for young children, but has yet to receive them. So what are the treatments available for Mpox? Treatment for Mpox is primarily supportive, focusing on elevating symptoms. Researchers are actively developing and testing various therapeutics that may be effective against Mpox. Prevention and control efforts rely heavily on raising community awareness and educating health workers to prevent infection and stop transmission. According to WHO, health workers and caregivers should avoid close contact with infected individuals or contaminated materials to reduce the risk of infection. Health workers and caregivers should wear gloves and other personal protective equipment when caring for the sick, whether in a facility or home. For Mpox infection resulting from animal to human transmission, avoiding contact with sick or dead animal is crucial. All animal products should be thoroughly cooked before consumption. What does this mean for the rest of the world? The WHO's declaration serves as a call to action, urging countries to act decisively to prevent further spread and save lives. It asks for diagnostic tests, treatments, and vaccine to be distributed where they are most needed, particularly in the under-resourced regions like Africa. Meanwhile, countries like China are taking proactive measures to monitor and control the spread of Mpox. Danish pharmaceutical company Bavarian Nordic has announced its readiness to produce up to 10 million doses of its Mpox vaccine by 2025, following the WHO's emergency declaration. Meanwhile, Pakistan has detected 3 patients with Mpox virus, the Health Department of Khyber Pakhtunkhwa province said on Friday. The department said that the viral infection was detected in the patients upon their arrival from the United Arab Emirates.